So far yet. Let me get over here and, okay, I can mute and unmute.
Okay, Mayor, we're about to get set here. Good afternoon, everybody, and welcome to our virtual news conference for the City of Grand Forks for Friday, April 24th. Yes, 24th. The days are blending together a little bit. We'll hear comments from our panelists, and then we'll open up to Q&A. Again, use the raise your hand feature so I know how to call on you, and we'll go from there. As we do always, we'll start with Mayor Brown.
Thank you very much, John. So I want to say good afternoon and thank you for tuning in. As a time-based follow-up from the mass testing event last week, Grand Forks Public Health, in conjunction with our state partners, conducted another mass testing event yesterday at the Alara Center parking lot. The event was well executed, and thank you to our public health team, state partners, and all those who helped with the event. A total of 713 people were tested, which included LM Wind Power employees that were not tested last week, close contacts of LM employees, first responders, and symptomatic members of the general public over the age of 12. We expect to have the results in a day or two. To those impacted through quarantine and isolation, those who have contracted the virus, or know a friend or family member that has, it's important to know that the community is here to support you. We've seen it time and time again here in Grand Forks, with local businesses donating meals to families in need, neighbors going shopping for our at-risk populations, and the tremendous support given to our healthcare professionals. Recently, in conjunction with the Salvation Army, we've been able to serve over 96 people and 23 families from LM Wind Power who are needing food for their quarantine. The mayor's office has even dedicated an employee full-time to communicating resources and connecting people with food and supplies. If you need help finding resources, please go to grandforksgov.com/resources. In addition to all the great and kind acts that we're seeing through our community, we must also be careful not to give in to baser instincts and succumb to disparaging remarks that target individuals or groups of people based on their backgrounds or beliefs. That's not America, and that's certainly not Grand Forks. We are a welcoming community, and we are all in this together. To those under quarantine and isolation orders, you need to abide by the direction and instructions from the state health officer. It's paramount that you stay home to prevent and stop the further spread of COVID-19 in our community. The Public Health Department, in collaboration with the City Attorney's Office and the Grand Forks County State's Attorney's Office, has protocols in place and are actively working to educate those individuals who are subject to quarantine and isolation orders about the need to comply. Protocols are also in place to obtain compliance for those that fail to comply. Our preference is for everyone to voluntarily comply with quarantine orders, but if the need arises to pursue legal avenues, we will enforce the orders, and we are prepared to do so. Lastly, I continue to have in-depth discussions with our community, business, and institutional leaders on what our smart restart Grand Forks looks like. The federal government and the state of North Dakota are in the process of releasing guidelines, and we are studying them and are creating a locally inspired, locally innovative, and locally led smart restart plan for Grand Forks. We anticipate further guidance from Governor Burgum and his administration early next week. We'll be prepared to follow up quickly with action-ready responses, as we have been working in parallel with them and our local partners. Thanks to our local businesses and essential service providers during these difficult times, we ask that you continue to make the health and well-being of your customers and employees the highest priority by enacting the CDC recommendations, strategically placing hand sanitizing stations throughout your businesses, and having your employees wear face coverings. Thank you. And now we'll hear from Dr. Weiser with Altru Health System. Doctor?
Good afternoon, Mayor. Thank you. It's Dr. Stephen Weiser, President of Altru Health System. I'd like to take some time today to express my heartfelt gratitude to my team at Altru and our partners in the public health locally and at the state level. The commitment of all these teams to fight COVID-19 should be commended. There have been long hours, stressful days, difficult decisions, and a lot of courage displayed. Thank you on behalf of Altru Health System for your commitment to the safety of our community as a collective group. For the past 6 weeks, Altru has been screening and testing those who meet state guidelines. For the majority of this time, we've offered testing to those experiencing symptoms. We're committed to continue to screen, test, and offer safe care for those with COVID-19 as well as our other patients. We have many protocols and processes in place to allow us to maintain safe care environments for our patients, families, and our teams. I want to emphasize that continued care is very important to our community. The situation we face with COVID-19 may not end soon. We may not experience business as usual for a while. With that in mind, please continue to call your providers. Seek care when you need it and don't ignore signs and symptoms. We are here to care for you safely with virtual care options, safe practices and protocols, and committed providers who are here to keep you well. I'd like to thank you for this time today. Thank you to our community for your continued adherence to physical distancing. I know this is tough, and it's been a very long 6 weeks. Please remember the safety of your neighbor, continue to stay home, stay safe, and remain kind to one another. Thank you, Mayor.
Thank you, Dr. Weiser. Now we'll hear from Debbie Swanson, Director of Grand Forks Public Health.
Good afternoon, Mayor Brown and members of the media as well, and to all of those who are watching this broadcast of this news conference. I wanted to provide just a few details about what happens next after this testing event that was held yesterday. You might have questions about how individuals will receive notification of their test results for COVID-19. All results are reported by the North Dakota Department of Health Laboratory where the testing is completed. The positive results are then sent to regional epidemiologists who assign each case for public health follow-up. This is the beginning of the contact tracing process. Because the priority is starting the contact tracing process in order to contain the spread of disease, persons with negative test results will be provided to participants early next week. We simply don't have the ability to inform everyone all at the same time. I also wanted to remind residents that the CARES 19 app is available by the state of North Dakota. You can download that. It's now available for both iPhone and Android telephone applications, and it might be helpful for individuals to report places that they have been. We want to thank everyone for their cooperation with all the recommendations we've made. We recently released some business guidelines today, and those are going to be distributed by business partners, the Chamber, and other individuals in the community. And we encourage everyone to take a look at those and do your workplace assessment as you think about what your current practices are and what your practices might be in the future. Thank you very much, and I'll be happy to answer questions at the end.
Thank you, Debbie. And now we'll hear from Dr. Brenner from the Grand Forks Public School System. Welcome, Dr. Brenner.
Thank you, Mayor Brown. Good afternoon, panelists. Good afternoon, everybody in the community who's watching this live stream. Terry Brenner, Superintendent, Grand Forks Air Force Base School Districts. I'm happy to be here today to provide a brief update for all of you. First of all, the Mark Sanford Education Center is closed for today for deep cleaning purposes. We are down to very much a skeleton crew at the education center, and basically the people we have on staff would be our technicians who are working split shifts to handle the 7,500 devices that we have deployed for all of our students in the event that some of them need service. And we do find that that's pretty much a daily occurrence. So the Ed Center is closed today, but otherwise it is open Monday through Friday from 9 a.m. to 12 noon. And people can call the tech support line to make a reservation to drop off their device and pick up one to replace the one that has been damaged or is in need of repair. All of our personnel remaining at our campuses, we are down to custodians at the school level working split shifts, staying away from each other, are wearing masks as per the directive of the city. So we are complying with all the leadership and the information that's being put out by public health and the mayor. So we thank you for that guidance. We're just completing our 16th day of distance learning. Some people might believe it's longer than that. Some people might think it hasn't been very long at all. We will acknowledge that nothing is perfect, but again, my commendations go out to all of our teachers and support staff and principals and central office leadership for pulling off something that was just short of miraculous. I've said this before, and I'll say it again in case we have some new listeners. We would have planned 2 to 5 years for blended learning or distance learning that we're involved in today. And what we did was we planned and prepared and implemented this new distance learning plan in 10 days. There will be some changes to the elementary schedule. We are listening to parents, we're listening to our elementary teachers, we're listening to our elementary principals that we may just be pushing out too much for our K through 5 students. So we're going to back off a bit, and there's going to be a communication that goes out at 4 o'clock today for those applicable families. So please be looking for that, parents. And we want you to know that we have been listening to all of you. I've already touched on the tech support. As far as child nutrition, Emily Carl, our child nutrition director, and her staff are putting out 2,000 meals per day, Monday through Friday, which also includes the following day's breakfast. So there's actually a breakfast for Saturday morning as well for those families willing to pick up food curbside. As far as reopening schools, we don't know how long we're going to be in this environment, but we are prepared to rethink what school looks like because there have been some lessons learned. And to my earlier point, blended learning opportunities, whether it's a combination of face-to-face, distance, asynchronous, synchronous, those have been part of our conversations for the past couple of school years. And this COVID-19 has just moved us down that path a little bit quicker. So we will continue to follow the lead of the governor, and we won't do anything until the governor tells us what we can or cannot do. The two most frequent questions that I get and most of our leaders are getting centers around prom and graduation. Both of those events are on hold indefinitely. And for the latter, graduation in particular, we are exploring all options so that our graduating seniors have a memorable capstone for their careers. And this is just a heartfelt thanks and appreciation going out to our seniors for hanging in there for what's been a difficult spring. Not only are they seniors and missing their classmates and moving through all those symbolic activities in the final 5 or 6 weeks of school, but many of them are co-curricular and extracurricular participants, so they are missing out on a lot this spring. And just want them to know that I have a heavy heart, like all of you, and for you. Our facilities task force that is exploring what we will be doing with our facilities moving forward continues to meet virtually. That committee of about 47 community members is meeting via Zoom Thursday evenings for an hour to an hour and a half, and they will get as much done as they can each Thursday as they prepare to make a recommendation or recommendations to the school board at the end of September in the fall. There could be some nuance differences or changes given the environment that we're in, but nonetheless, we still want this study to be conducted. And on some good news, not that everything has been gloom and doom, we had a committee apply for a literacy grant, and we've been awarded $3.5 million over the next 5 years. It's very good news for the Grand Forks Public and Grand Forks Air Force Base school districts. And the CARE Act funds that will flow through the state and to our school district will top off just a little over $2 million, which will help us offset some of the expenses that we're incurring with distance learning. So with that, I will pause there and allow time for others, and we'll stay on the call for questions at the end. Thank you.
Thank you, Doctor. These are challenging times, but it sounds like you and your staff are up to the task. So thank you very much. So next we'll go to John Bernstein for question and answer portion of our virtual news conference. John?
Yes, I'll open it up to the media, use the hand raise feature. I also want media to be aware we do have Grand Forks City Attorney Howard Swanson and Grand Forks City Administrator Todd Phelan available to answer any questions as well. First question will go to Grand Forks Herald and Mr. Joe Bowen.
Hey there. So Simplot said yesterday that they didn't tell their employees about the test that day because the company felt the tests there would be better used out in the community. Is that the case? Were those tests indeed better used, like from a public health perspective, on the public at large rather than on Simplot employees?
Yeah, thank you, Deb.
I can take that question. Yes, we were informed that Simplot didn't message their employees, and part of that reason was they were shutting down their plant. And we did allow the public to attend. We did send a message out yesterday afternoon during the testing event that we would allow members of the public to come if they were over the age of 12 and they had symptoms. And we had around 300 people attend the testing event after that announcement was made. So we think it was overall a very successful day yesterday.
Sorry, so but is it better to test the public at large than Simplot employees? Which would you, if you were Empress Debbie Swanson in charge of everything, would you rather have tested those employees at Simplot or the public at large with those tests?
I don't think you can say that there's a better public health case for one or the other. We did testing to the best of our ability, given the circumstances that we had, and we were able to test a lot of people, and we feel we had a very successful event, and we look forward to seeing the results. Certainly being able to test people with symptoms is a very important endeavor.
Thank you, Deb. Next question comes from Chris Larson from Flag.
This is for Dr. Weiser. With the state of medicine and hospitals right now, there's a lot of hospitals talking about having to make cuts. Where do you feel Altru is at this point going forward out of COVID-19?
Well, good question. I've been asked similar ones. I don't have a crystal ball where we're going to land. I don't know how long this is going to be protracted or how fast a recovery will be. At this point in time, we have no set decision on making any cuts. We are just right now flexing to the volume and our capacity at this time, using our SRA and furlough options in order to maintain the benefits for all our employees. And we will ramp up as the business ramps up and flex to the level of the business in order to maintain our workforce, to take care of the citizens of the community and region and deliver the care we need to.
Thank you, Dr. Weiser. KNOX and Mr. Ryan Cunningham.
Question for Dr. Weiser and for Debbie Swanson. And the question is, the data coming out of the U of M and the Minnesota Department of Health is indicating that the number of positives we have is about 1% of the total number of people that are infected out there. So if we applied that in our area, that would mean that we have about 17,000 infected people in Grand Forks County and about 73,000 infected people in North Dakota. Do you concur with those numbers? Do you feel those numbers are based on good data?
No, Dr. Weiser.
All right, so I'm very aware of all the different modelings that we've been going through, and now we're starting to do more broad-based serology, and a probably more accurate representation is what they're finding in New York State, and their extrapolations that there's been such a high asymptomatic rate. So the endemicity appears to be that it's far more widespread. The problem is the level of testing that's still available to confirm that with accurate testing that don't capture false positives or other types of viruses that would represent corona makes it difficult to really know what the true value is. I do believe that the number of people that have been exposed is a lot larger, but I don't have any valid analysis to stand behind it. We have to go with our best knowledge that we have right now. It could be that high. I think we'll know more as more broader testing is available. I think the safest thing is the processes we're doing now, using the valid tests that are out there now, and self-isolating, identifying the sick patients, and protecting the rest of the community, especially the at-risk. Because I think the follow-up question to you would be, if it is that broad spectrum, then the mortality rate is quite low, and then why are we fearing this and locking things down? And those are eloquent, fair questions, but I don't think we have enough of the knowledge there yet to go down that pathway all the way. It's about safety right now and protecting the risk population.
Thank you, Dr. Weiser. Next question from Neil Carlson from iNews.
Hi. Yeah, to set this up, coming up Sunday and Monday, Valley Senior Living, Maple Memory Care, staff and residents all getting tested there. There's another 1,000 tests along with the over 700 we had yesterday. I guess for Ms. Swanson and Dr. Weiser, a couple part thing. You think that'll give us a lot clearer number of what's going on in the community with nearly 2,000 more of those tests in? And also, are you aware of any other hotspots in the county?
Deb Swanson.
To answer your last question, I'm not aware of other hotspots, but definitely by doing more testing, it will give us a better picture of the possibility of asymptomatic people carrying the virus. And I think it will also help us make sure that we contain any spread of the disease in those populations that are most vulnerable, which is why our state is making a concerted effort to try to test in long-term care in other congregate settings.
Thank you, Deb. Question from Dave Kolpak from the Associated Press.
Yes, can you hear me?
Yes, we hear you fine, Dave.
Yeah, this is for the mayor and/or Debbie. There's been a suggestion in the last couple of days, some stories written that perhaps the protocols have changed in terms of inspections and investigations into some of these companies, in particular in reference to LM. I mean, is that true? Did they do things differently once upon a time?
Well, I do know that when we received the employees concern March 22nd, that our role was to educate and communicate to them that the CDC guidelines and recommendations were in place, and then they assured us they did follow up with that. But as things have evolved, as we learn more about this pandemic and responding to this pandemic, there are things evolving and coming in place. But at that time, the mayor or the city had no mechanism to inspect or enforce anything like that. So with communication, we were relying on communication to upper management to make sure that they complied. They said they complied. So yes, things are evolving as this pandemic continues.
Thank you, Mayor. Mr. Joe Bowen from the Grand Forks Herald.
Hey there. So the plan for yesterday then, was it indeed to try and test all employees of Simplot? And if so, why was that important to do?
Deb Swanson, please.
The employees of Simplot were invited to attend, and that information was shared with the city. And their decision not to offer it was based on the fact that employees had access to testing if they needed it through their benefits plan. So thus we were able to shift our resources and test others in the community.
Right, but I'm wondering, why was the plan yesterday, initially anyway, to test Simplot employees? Why was that important?
I think the decision was made based on the fact that it was a large manufacturing plant, and we had circumstances that led us to believe that manufacturing might be a place where there is congregate shared workspaces. And so they were simply reached out to. It wasn't specific to any reports of cases there.
Thank you, Deb. Ryan Cunningham and KNOX.
I wanted to follow up with City Attorney Swanson, if I could, regarding the mayoral powers with the emergency declaration that has been granted by the City Council. On Monday, I asked if those emergency powers allowed Mayor Brown to examine a workplace or to notify OSHA directly if there was a problem. What exactly does the mayor have the power to do with those emergency powers in place if there's a complaint from an employer that things aren't being done correctly?
Mr. Swanson.
Thank you. The mayor does have emergency powers under the city code. Inspecting workplace sites is not one of the enumerated powers. It may, however, fall into kind of a catch-all phrase, but other than that, the city could have gone out, but we had no enforcement authority. The CDC recommendations or guidelines do not carry the weight of law. Further, the complaint, as I understand that came in, did not involve any code violations that the city does have primary jurisdiction to follow up with. With regard to your question, could the city have made a report to federal agencies? Sure, the city certainly could have done that. It had it appeared necessary to do that.
Thank you, Howard. Looking to the media for another hand raised, Mr. Joe Bowen.
Yeah, sorry about that. I thought I had it up. Of the 713 people, I think that's the right number, tested yesterday, do you know now how many are close contacts of LM employees? How many actually were Simplot employees? And how many are just like members of the public at large? Do you have that breakdown yet?
We do not.
Do you expect it anytime soon? Like, is that something you would end up having?
One of the challenges that will happen is that it'll take some time to cross-reference the employee list from LM Wind Power and any newly positive test results or results of anybody who came through our testing because of the way that it was conducted in a large scale like that. That will be done by the North Dakota Department of Health, and it may take some time to extrapolate all that information. Right now, our focus will be on the positive cases, the positive test results, and beginning the contact tracing process.
Thank you, Deb. Ryan Cunningham with KNOX.
Question for Dr. Brenner. Earlier this week, Dr. Wynn at the University of North Dakota was asked about students on campus for the fall of 2020 or the 2020-2021 school year. There's a lot of numbers, so you have to say them all rather quickly so people know what you're talking about. His answer to that was that he expected a new normal of periods of on-campus instruction and then elongated periods of instruction where people were not on campus. So is that a conversation that's happening in the K-12 system in North Dakota, in the Grand Forks Public Schools? Are you planning on, if there's this second wave that's being talked about, sending kids home again this coming fall at some point or this coming winter at some point?
Thanks for the question, Ryan. We're making all kinds of plans and accommodations for when school starts up, what school will look like. And I don't want to be elusive in my response to your question, but we are waiting for a directive relative to can we go back to our campuses or not? And if we can, is it going to be more of a soft opening? We're going to limit access to the building in terms of student numbers and what that might look like. So it could be a combination of face-to-face distance learning. We might have a morning shift of students and an afternoon shift of students where we can do some cleaning in between. If we're not allowed to return to campus at all, distance learning will continue. If you can hear my puppy in the background, she wants out of her chair right now. So what a great time for her to start talking to me. So all options are on the table, and we'll make certainly all the accommodations that we need to make sure everybody remains safe. The other factor in all of this is if the governor says you can return to school, it's business as usual, we may have a number of families or parents who opt out of that. And then we'll either have to make accommodations for distance learning that way, or homeschooling becomes an option for parents. And we certainly hope they don't take that route because we still want all students to be part of our educational family. So time will tell, Ryan, but when we know, you will know.
Thank you, Dr. Brenner. Next question from Mr. Dave Kolpak.
Yeah, Debbie, will it ever be possible to get to the point where all the LM employees and all their contacts and their contacts, et cetera, will be accounted for? I mean, can you get to that point, and what's that going to take?
Well, that's certainly our goal, but what I can tell you is that's going to take some extraordinary effort. And right now we have a really talented, hardworking team of contact tracers that includes staff from Grand Forks Public Health Department, the North Dakota Department of Health, our regional public health partners, and some students from the MPH programs at UND and NDSU. So this is an extraordinary effort that everyone is putting forward to try to ascertain who all the individuals are that tested positive and that are contacts of people who tested positive. That goes for employees of any workplace, anywhere in the community. And as the health department director, we are largely responsible for those who are county residents of Grand Forks County. So we are going to do our absolute best to find everyone to help us contain the spread of disease. This is the one tool that we have that's most effective right now.
Thank you, Deb. We got time for two more. We'll go with Mr. Joe Bowen.
Hey, this is a community question we got here from someone who manages a bar in town. They're wondering, is it realistically think that bars and restaurants can open again next month?
I would think with a data-driven restart smart, I think there's a possibility. It won't be the way you did it before, but I think it's on the table and we need to consider that. So is the possibility next month? Yes.
Okay, thank you, Mayor. And final question from Mr. Chris Larson.
Mayor Brown, do you think that when this economy opens up, we've been closed now six weeks, you see us ever getting back to the old normal, or is it going to be a new normal now?
I think it's going to be Grand Forks has a wonderful history of recovery after these types of things, like the flood of '97, downsizing of the base with the loss of the missile wing and the bomber wing, and then the recession of 2008. And I think we all are anxious to get out and start shopping and dining out. So will we come back? I think it's going to come back with a vengeance. So yes, I think we'll be stronger than ever.
All right. Thank you, members of the media, for joining here. It's wonderful. And as we have with these news conferences in the past, thank you to our panelists. Our final word from Mayor Brown.
So remember to stay home, practice physical distancing, sanitize frequently used surfaces, and wear a face covering when in public settings. The virus does not spread itself, we do. It's imperative we take responsibility for our community and follow the guidelines and recommendations. Stay home, slow the spread, save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor Brown, and thank you to everyone. This concludes our news conference for this afternoon. Hope everyone has a good weekend. Good afternoon, everyone.